Thyrotoxic storm. So we're going to see 5 sensible points about thyrotoxic storm this audio clip. So thyrotoxic storm is nothing but an extreme form of thyrotoxicosis. So this is going to be the first point in our short note, and also just to know 5 sensible points about thyrotoxic storm. I think these are handpicked points, so it won't be a problem for you. This 5 minutes is going to be really good. Okay. And first, we are looking at the causes. Why will such a storm happen? Is there any problem with the pressure? That's right, so there's work pressure, stressful illness, or okay, we're just gonna see 3 main causes. Okay, so first one is the stressful illness. So like the person is really very ill, and the person has an underlying thyroid condition, and then it's going to get worse. That is thyroid storm. Okay, second is there is a person who is a hyperthyroid, and then the person is planned for a surgery, but then before surgery, prophylaxis is not given properly. So that's the second cause. Third cause is administration of radioactive iodine. Radioactive iodine is actually a anti-thyroid drug kind of a thing, an anti-thyroid therapy. But in the initial stages, because it is going to, char the thyroid tissue, some thyroid is going to leak, causing a thyroid storm. So what are the 3 causes? A stressful illness is the first cause. The second cause is going to be a poor pre-op preparation for a hyperthyroid patient surgery. Third one is radioactive iodine. Moving on to the third point of this video, which is pathology. The pathology here is that the T4 is very high, and then the T3 is very high because the T3 is going to be synthesized from the T4. And the T3 is going to stimulate the beta receptors here and there. So it causes an adrenergic problem. So like there is adrenaline hyperactivity, which accounts for the clinical features of thyrotoxic storm. Okay. There could be, okay, so moving on to the fourth point of the video, which is clinical features of thyroid storm. Thyroid storm has all the clinical features of hyperthyroidism just manifested in a very high manner. So I'm just going to say 3 most important points among the clinical features. A person has a heart rate which is very high, so there is tachycardia. Second is there is atrial fibrillation. Third one is there is acute abdominal pain. That's right, there is vaitavali. So the person has tachycardia, atrial fibrillation, and acute pain abdomen. So these are all the severe features of hyperthyroidism. Apart from that, you can make up other features of hyperthyroidism. Like for instance, the person has a lot of sweating, the person's temperature is very high, shooting up, and the person is so confused, there's too much anxiety, the person is agitated. The person keeps running to the toilet because there's a lot of diarrhea. Okay, so the main thing is the heart. Heart is always the most important one. The heart, the brain, right? Yeah, so which is why for the heart there is palpitations, tachycardia, atrial fibrillation, and for the brain there is just like confusion, agitation, and all. And then the third most important organ I would say is the stomach, because that's what helps us survive. So there is acute pain abdomen as well. Right, moving on to the fifth sensible point of this video is the treatment. How we were supposed to treat a thyrotoxic storm. We have 6 treatment modalities. We're going to see one by one in detail. Not in detail, just we're going to see one by one. 0.9% saline is given. And second is a beta blocker, because we already know it's like a beta crisis. Beta is too hyperactive, so we're going to use a beta blocker. The beta blocker of choice is propranolol. The third one is an antithyroid medication. So we are going to use a PTU, which is propylthiouracil, because you don't want to do a UPT and confirm if the person is pregnant or not. We are going to use propylthiouracil because it can be used in pregnancy as well. And this kind of a thyroid storm occurs mostly in women, because women are the people who are going to have a lot of thyroid problems. And fourth one is Lugol's iodine. Fifth one is steroids like hydrocortisone and dexamethasone. As we already know in endocrinology, the rule is whenever we are going to administer any hormone, we always give it along with a steroid, because steroid just calms the immune system and prevents the immune system from doing some nonsense to like prevent it. Okay, moving on to the infection. We are going to treat the infection with antibiotics just in case the person has infection. Okay, ignore that message. Okay, treatment once again as a quick recap: 0.9% saline, which is nothing but normal saline. Second is beta blocker propranolol. Third is PTU, propylthiouracil. Fourth is Lugol's iodine. 5 steroids. 6 is antibiotics. Thank you.